Hello friends, welcome to Dr. Nancy's Daily Bytes. Our video is on Recall Question and Answers Neet MDS 2022 Part 1. A patient reported to the clinic with a chief complaint of pain in the upper front tooth region and gives history of trauma 5 years ago. Clinically, no significant changes are seen. Radiographic image depicts dents in dent, external resorption, internal resorption, dents in vaginatus. Answer: internal resorption. Propranolol, widely used in thyroid storm, decreases the sympathetic activity of thyroid gland and increases iodination of tyrosine, increases thyroxine binding, decreases peripheral conversion of T4 to T3, increases release of thyroxine from gland. Answer: decreases peripheral conversion of T4 to T3. Dentigerous cyst arises from irritated pedial fibers, unerupted teeth, osteoradionecrosis, teeth with root caries. Answer: unerupted teeth. Identify the structure that is seen in the given radiograph. Supernumerary teeth, paradents, distomolar, paramolar. Answer: supernumerary teeth, that is mesodents. Best test to evaluate syphilis after treatment is TPA, FTA, ABS, TPHA, VDRL. Answer: VDRL. Herringbone pattern appearance is seen in which of the following condition? Xanthoma, fibroma, acanthoma, fibrosarcoma. Answer: fibrosarcoma. A pregnant lady died after giving birth to the baby. On examination, hypotension, tachycardia, cold and cyanotic extremities and loss of consciousness was seen. Examination of lung and the brain revealed infarcts and depositions. The cause of a death might be microbial infection, massive hemorrhage, amniotic fluid embolism, sepsis due to improper sterilization. Answer: amniotic fluid embolism. Among all of the following muscles, the only muscle that helps in the abduction of the larynx is cricothyroid, transverse arytenoids, posterior cricoarytenoids, all of the above. Answer: posterior cricoarytenoids. Tongue muscles develop from first pharyngeal arch, lateral lingual swellings, occipital myotomes, preoptic myotome muscles. Answer: occipital myotomes. Specimen of intestine shows large ovoid ulcer along long axis of intestine without perforation. This characteristics is of which disease? Ulcerative colitis, intestinal TB, typhoid, Crohn's disease. Answer: typhoid. What is type 1 error? Rejecting the null hypothesis when it is false, rejecting the null hypothesis when it is true, accepting the null hypothesis when it is true, accepting the null hypothesis when it is false. Answer: rejecting the null hypothesis when it is true. A public health dentist conducted a survey to know the relationship between smoking and lung cancer. But among the control and sample group, few of them also have the habit of alcohol consumption. In this study, alcohol is risk factor, selection bias, Bergsonian bias, confounding factor. Answer: confounding factor. Tripoding is seen in which of the following grasp of instrumentation which gives a better stability control? Pen grasp, inverted pen grasp, modified pen grasp, palm and thumb grasp. Answer: modified pen grasp. Dewey's triple response caused by the histamine will show which of the following characteristic features? Flush flare wheel, white blue red line, zone wheel flare, red line flare wheel. Answer: red line flare and wheel. A microscopic staining of the throat swab showed that there is presence of volutin or metachromatic granules that are present and represent the Corynebacterium diphtheria. What is the staining that is done in this case? Albert staining, acid fast staining, Gram staining, Indian ink staining. Answer: Albert staining. Which form of anemia is called Cooley's anemia? Alpha thalassemia, beta thalassemia major, beta thalassemia minor, sickle cell anemia. Answer: beta thalassemia major. Based on the following radiograph shown below, give the diagnosis. Benign tumor of the salivary gland, malignant tumor of the salivary gland, psilodochitis, Sjogren syndrome. Answer: psilodochitis. Organic lining of the calcified dental tubules, is called lamina lucida, lamina densa, lamina limitans, lamina propria. Answer, lamina limitans. Drug of choice in PSVT condition is adenosine, furosemide, lignocaine, prilocaine. Answer, adenosine. Identify the structure seen in the picture after thyroidectomy for the surgery of multinodular goiter. Trachea, vertebra, esophagus, hyoid. Answer, trachea. The given image depicts which of the following law according to Krasner and Ranko? Law of symmetry, law of cement-enamel junction, law of color change, law of concentricity. Answer, law of symmetry. Identify the probe that is shown below. University of Michigan O probe, WHO probe, Neighbors probe, University of North California UNC 15 probe. Answer, University of North California UNC 15 probe. Identify the following condition in the radiograph: dense in dent, taurodontism, dense invaginatus, ghost teeth. Answer, taurodontism. Give the diagnosis of the following condition: dilated odontome, dense invaginatus, dense invaginatus, none. Answer, dense invaginatus. A 64-year-old patient presented with generalized weakness and is diagnosed with lymphoproliferative disorder. The serum analysis shows monoclonal IgM spikes in serum and Bence-Jones protein in urine. It is indicative of lymphoma, multiple myeloma, Hodgkin's lymphoma, Burkitt's lymphoma. Answer, multiple myeloma. What is Coffin's corner? Retromolar pad triangle, tonsillar fossa, posterior pharyngeal wall, pharyngeal pouch. Answer, tonsillar fossa. Healthy volunteers are used in which phases of the clinical trials? Phase 2, 3, 4, 1. Answer, phase 1. A 52-year-old male patient reported to the clinic with deep caries on the occlusal surface. Patient was asymptomatic. On radiographic examination, radiopaque mass is present at the apex. What is the diagnosis for this case? Osteomyelitis, condensing osteitis, cementoblastoma, periapical abscess. Answer, condensing osteitis. Preferred site of injection in gluteal muscle is supromedial, supralateral, inframedial, infralateral. Answer, supralateral. Anatomically, the upper lobe of kidney lies in relation to which rib? 9, 10, 12, 11. Answer, 12. Which of the following is true about Quincke's sign in aortic regurgitation? Popliteal pulse pressure, head nodding with each heartbeat, presence of blanching and flushing of nail bed on pressing, that is capillary pulsation in the nail bed, pistol shot sound in femoral artery. Answer, presence of blanching and flushing of nail bed on pressing, that is capillary pulsation in the nail bed. Which of the following microorganisms is responsible for pregnancy gingivitis? Prevotella intermedia and Treponema denticola, Porphyromonas gingivalis, Actinobacillum actinomycetum comitans, Tannarella phocitis, Prevotella intermedia and Tannarella phocitis. Answer, Prevotella intermedia and Tannarella phocitis. Identify the marked area that is shown in the radiograph. Mental ridge, nutrient canals, mental foramen, anterior nasal spine. Answer, nutrient canals. Identify the following image: Jones jig, K-loop distalizer, none, M-loop. Answer, K-loop distalizer. Identify the marked structure in the given radiograph: condyle, sigmoid notch, coronoid, anglophragmus. Answer, sigmoid notch. A 45-year-old female patient looks anemic. She has chelosis and also koilonychia on fingers. And also she complains of frequent tiredness, fatigue and difficulty in swallowing. What is the syndrome associated with it? Stooge-Weber syndrome, Plummer-Vinson syndrome, Eagleton syndrome, none. Answer, Plummer-Vinson syndrome. A child patient reported to the clinic. On examination, he has limited mouth opening. Also, the patient complains of difficulty in breathing. What is the diagnosis of the case? Pericoronitis, bilateral TMJ ankylosis, ANAG, herpes labialis. Answer, bilateral TMJ ankylosis. A patient reported to the clinic with a chief complaint of severe pain in lower left back tooth region, and also there is pain to vertical percussion, and also swelling is present in the soft tissue adjacent to the teeth, and also the tooth has lifted up in the socket. What is the diagnosis? Acute apical abscess, chronic apical abscess, reversible pulpitis, irreversible pulpitis. Answer, acute apical abscess. Not a branch of third part of maxillary artery. Infraorbital, pharyngeal, greater palatal, supraorbital. Answer, supraorbital. Osteomalacia is characterized by defective osteoid plus normal mineralization, abnormal osteoid plus abnormal mineralization, normal osteoid plus defective mineralization, normal osteoid plus normal mineralization. Answer, normal osteoid plus defective mineralization. Infranuclear low motor neuron lesion of the facial nerve causes contralateral upper half of the face paralyzed, half of the face is paralyzed, ipsilateral half of the face is paralyzed, contralateral lower third is paralyzed. Answer, ipsilateral half of the face is paralyzed. Identify the structure marked by the arrow in the image given below. Sprue, investment, reservoir, crucible. Answer, reservoir. What is the contraindication for the processes given below? Short span ridge, periodontal probing, single posterior tooth restoration, deep bite. Answer, deep bite. Which one of the following is the best retention method that is used for the orthodontic treatment? Beck's retainer, Holly's short labial brow, band and spur, lingually bonded fixed canine to canine. Answer, lingually bonded fixed canine to canine. A boy child reported to the clinic he has improper occlusion so that he protrudes his jaw forward and bites. Based on the given findings, give diagnosis and prognosis. Pseudo class 3 with good prognosis is the answer. The options are class 3 malocclusion with good prognosis, pseudo class 3 with good prognosis, class 3 malocclusion with poor prognosis, and pseudo class 3 with poor prognosis. The most sensitive index for fluorosis based on the histological changes in the enamel and fluorous teeth is Community Fluorosis Index, Dean's Fluorosis Index, Thilstrup and Fejosco's Index, Modified Dean's Index. Answer, Thilstrup and Fejosco's Index. In the given picture below, identify the grade of IOTN 2, 12, 10, 9. Answer, 10. Patient with no perioral muscular coordination is seen in which type of cerebral palsy? Ataxic, dyskinetic, spastic, athetoid. Answer, spastic. Which of the following precancerous lesion has malignant potential? OSMF, erythroplakia, oral lichen planus, syphilitic glossitis. Answer, erythroplakia. C wave in JVP is seen due to atrial contraction, atrial filling, tricuspid bulging using isovolumetric contraction phase, rapid ventricular filling. Answer, tricuspid bulging during isovolumetric contraction phase. Guys, in the future videos, we'll see both the question and answers along with the explanation. This is for rapid revision. I have put only the question and answers. Thanks for watching, guys. Subscribe for more videos and click on the bell button for instant notification. See you soon with another video.